Okay, in this chapter we're going to cover assisting in geriatrics. Okay, chapter 41. And the learning outcomes for this chapter are going to involve looking at the developmental changes in geriatric patients, looking at some of the normal changes that our body goes through as we age. We'll be describing some common geriatric diseases and disorders that you see in this patient population. There are some variations of care that we have to look at, just like the pediatric patient. There are some things to look at that are kind of special instructions to go along with our geriatric patients, and there are certain specific screening procedures and tests and treatments that they should still maintain as they get older. And then some of the special health care concerns of the geriatric patient, just like pediatric patients have as well. And so when we look at geriatrics, this is the specialty area that concerns the elderly, generally over 65. Just like the pediatrician is a specialist for children, the specialist for elderly is called a geriatrician. Honestly, you don't really see too many doctors that call themselves, quote unquote, a geriatrician. A lot of times you'll see family practitioners will actually deal with geriatric population as well as adult population and kids, so they sometimes have an array. Oftentimes it's an internal medicine doctor that will actually take care of, have a high number of geriatric patients. And this is primarily because the internal medicine doctors are used to dealing with diabetes, heart disease, liver issues, kidney issues, and a lot of the detailed, complex medical things that can actually go along with the geriatric population. So, as a medical assistant, and you're looking at a family practice situation, because a lot of you will wind up in family practice, up to 50% of your practice could be the older sector of patients. And so it's important to be able to communicate, have empathy and understanding for this patient population. Okay. And so when we actually look at the physical changes that go along with aging, because of these changes, it may make the elderly a little bit more prone to disease and disorders. Okay. And obviously this can vary from person to person, depending on how well they have kept taking care of themselves through the years. Their diet, their exercise levels, smoking, alcohol, all of those things can affect later on in life. Okay. The other thing that can play a part too is genetics. Sometimes people just have a good genetic makeup, combination from their parents and their grandparents. And so some people, will look and they'll have all of their relatives living to be 95 or 100, and then other people, sometimes they aren't as lucky. And so there can be a mixture of how you lived your life as far as environmental factors as well as a genetic factor. Okay. And so the changes for each individual is going to vary from person to person. So the first couple of pages in the chapter talks about some of the actual physical changes that we see in aging. When we're looking at the tegumentary system, which is the skin, the skin, hair, and nails. One of the things that actually does happen is the skin does start getting thinner, and that subcutaneous layer right underneath the skin starts to atrophy a little bit, so we don't have that extra support layer. Okay, so that's why a lot of times blood vessels look very prominent in this sector, whether it's in the arms or in the hands, because they don't have as much of that sub-Q layer. The melanocytes actually start to accumulate, and you get something called liver spots or lenigos. And so those are kind of like aging spots or liver spots that are kind of common in this age group. The melanin in the hair starts to change a little bit too and starts to decrease. And so you actually start to see graying of the hair as well as thinning of the hair as well. The nails can get kind of dry and brittle. And the body doesn't really have the same inflammatory response, which is actually part of the immune response. And so that's why some geriatric patients age-wise are a little bit more prone to autoimmune diseases, infection, as well as even certain cancers. Nervous system wise, we do see that over time we do have a little bit of a decreased reaction time and thought process. It isn't that adults can't learn, because they certainly can, but there does tend to be a shortened attention span and thought process. They can lose a little bit of memory. I know I lose my keys all the time. The attention span can be a little bit shorter as well, although this can vary from person to person. Fine motor skills can start to struggle a little bit. And so you'll see a cascade of those things that are involved doing things to actually keep your mind sharp, like reading and even watching games like Jeopardy, doing Sudoku, crossword puzzles, those kinds of things kind of help to keep the brain sharp. And so it's important to kind of talk to this sector about doing different kinds of things to stimulate neurologically their neurologic system. Special senses wise, this is looking at vision and hearing. Obviously, there reaches a point where our lens doesn't bend as much, and so a lot of times eventually these people need at least reading glasses, just because age-wise that the lens doesn't bend as well, and so we can't see things quite as well, and we need to have things brought up closer. Hearing is definitely an issue too, whether it would be sensorineural from maybe different possible environmental factors, or even just conductive through age and time. It happens. So a lot of times this sector will need hearing aids, and they can be quite costly. And so that's one thing I think Medicare, they're looking at trying to make those things a little bit more affordable. Another thing that happens too is taste sensation can get a little altered. A lot of times they'll start to have sort of a metallic taste, especially things that are acidic don't taste as good. And so that can kind of contribute to food intake and what have you because of this altered taste sensation that can occur. Musculoskeletally, there's a number of different disease processes that they talk about here. Then with the musculoskeletal system, they kind of focus primarily on osteoarthritis, which is basically degenerative joint disease. It's wear and tear on the joints. You see it mostly in the weight-bearing joints, which are the knees and the lower back. It can affect other areas. If somebody had a motor, some sort of accident, football player, what have you, you could have shoulders and other joints that are involved, but primarily it's wear and tear. And so it can be quite difficult to try to maintain exercise when you have knee issues, as well as low back issues. So those can be things that can impair one's ability to be able to just maintain good activity to keep the musculature going. And then the other issue we look at is osteoporosis. Now, prototypically, you'll see females more involved with osteoporosis, but this isn't. You can still see males. And around menopause, 50, give or take a year or two, which is the average age of menopause, the estrogen levels drops. And estrogen is actually responsible for calcium, the osteoblastic activity of actually putting calcium in the bone. Some of that is due to the response of estrogen. And so when estrogen goes down, it tends to increase the osteoclastic activity. So we have more breakdown of bone than buildup, and that can lead to the bones becoming brittle and porous. And so then it makes the risk of osteoporosis much more evident at this age. There's something called a DEXA scan, which we will generally refer people to in this age bracket every 2 years to kind of see whether or not that person has the density of their bone is low enough that it would qualify for osteoporosis. Calcium consumption, vitamin D consumption, as well as weight-bearing exercises like walking or dancing are very important to preventing osteoporosis. Minimizing smoking and alcohol and caffeine are also important as well because those three factors can increase the risk as well. Then we see some gender predisposition as far as females over males, as well as Caucasian and Asian females. So that has a risk factor too, those two cultural groups, as well as stature and weight. thinner females are going to have a higher risk than normal weight, or women that are a little overweight. Adipose tissue actually creates estrogen, a little bit of estrogen, and so we don't see it as often in overweight or obese females as compared to thin females. So those are all things to kind of look at, okay? The other thing that happens too is that the musculoskeletal fibers, the protein fibers in the muscle, tend to decrease in size a little bit. Once again, this does vary from individual to individual. And obviously, if you're an active weightlifter and doing things in that category, you might not notice it as much, but this is sort of a normal change that does occur. Cardiovascularly, there's a lot of stuff that can happen. Primarily, this occurs because the heart has had to beat so many times during the lifetime that sometimes that can be an issue. The other thing that starts to happen is our vasculature changes. The arteries can become, over time, there can be plaque buildup, thrombosis, atherosclerosis can build up, which can lead to damage of the arteries, as well as arteriosclerosis, which is decreasing elasticity, and so it can make the blood vessels more at risk for rupture or aneurysm, and all of those factors can put a risk on the cardiovascular system, cholesterol level, whether or not there's a presence of diabetes, and so all of these things can play a part on the cardiovascular system. Respiratory-wise, we start to find that the cartilage tends to become, there's certain areas in our body that have cartilage, our nose, our ears. There's also cartilage in our rib cage that allows for movement of the lungs. And so over time, that cartilage can become a little calcified, doesn't tend to be as movable. And so that can kind of cause a secondary decrease in elasticity of the lungs and also a little bit of shortness of breath. And so that can be just kind of a normal, slow, progressive change that occurs. And then if we have someone with osteoporosis, we can get that abnormal curvature in the back called kyphosis, which is also called a humpback. And so if someone's body tends to hunch over a little bit, that can impair being able to take a full breath from the lungs as well. Immune system-wise or immunologically, we do find that kind of like when you're a kid and your immune system hasn't built up yet, and it increases the risk for infections. We kind of see the same thing start to happen in the elderly sector. Their body doesn't have the same inflammatory response. And remember, inflammation is pain, swelling, redness, and pain, swelling, redness, and erythema. Okay, so those things kind of are involved with inflammation. But when you don't have that same inflammatory response, that means the immune system doesn't quite kick in as quickly as it normally would, which makes the elderly sector more at risk for infections, pneumonia, and the flu, and what have you. It also makes them at increased risk for autoimmune diseases. Their body has a tendency to attack itself rather than attacking whatever the pathogen is that it needs to. And there are certain cancers that seem to be a little bit more common in the elderly sector as well. Digestive-wise, this is a real common one because there can be, we haven't hit the urinary system yet, but because there can be urinary issues, increased urination and incontinence issues, a lot of times the elderly sector won't drink as much water to make up for that. And then when that happens, and sometimes they don't eat the same amount that they used to, they don't get as much fiber in their diet, they'll then become constipated, they can become fecally incontinent as well. And so this can create a cycle of starting to use laxatives, and they can get what's called a kind of constipation diarrhea cycle because of medication. Not to mention the fact that a lot of the medications can cause constipation as well that they wind up taking. So the digestive system, adequate water intake and adequate fiber intake, as well as exercise, are three very important components to the digestive system. Genitourinary, just kind of mentioned that. They do have a few less nephrons. Remember, nephrons are the functional unit of the kidney. So over time, those deteriorate a little bit. So you don't have as much kidney function. And so that can be reflective and seen on blood testing. And so they also can have, because of menopause, the tissue, they're looking at the female patient, the tissue in the area doesn't have as much estrogen, and so a lot of times women will start to have a little bit less bladder expansion, and they'll tend to have urge incontinence, stress incontinence, and men can have the same issue too, especially if they have prostate issues. So these are all things that can affect the genitourinary system, and if you're getting urinalysis exams on this patient population, it is important to know whether or not they're having nocturia, which is excessive urination at night, or whether they actually are having some form of incontinence, whether it's stress or urge incontinence, okay, because that can affect urinary tests as well. Endocrine-wise, remember endocrine is our glandular system. Over time, we do find that the thyroid gland doesn't quite produce as much thyroid as it normally does, and so they can start getting some lower thyroid function. That can affect a lot of different body parts. They can have that can affect their bowels as well. Their skin can be dry, and their metabolism just doesn't work quite as efficiently as it normally would. Okay, same thing with the lower estrogen and aldosterone or testosterone. As we get older, women go through menopause, their estrogen levels drop. Men over 40 can start to have slightly decrease in their testosterone levels, and both of those things can affect some of the multiple things that we've talked about in these other systems. And then there's a decreased response to insulin. So this is why sometimes the elderly sector, if there's a family history of diabetes, because of that decreased response to insulin, you can start to see diabetes increase as we get older as well. There's usually a genetic component to it, even for non-insulin dependent. But that's that their loss in subcutaneous tissue, the insulin receptors don't work as well, and so they don't have that same pickup of that glucose, and so you start to find some insulin resistance in these patients. That was sort of the physical aspects that can change in the geriatric patient. We can also see some cognitive or intellectual developmental changes. It can take a little bit longer to process information. They certainly can learn, but they usually they usually lose their short-term memory first, or acute short-term memory. Long-term memory tends to remain intact for quite a while, even with Alzheimer's patients, even in their second stage. When they really are struggling with their short-term memory, they will a lot of times maintain great portions of their long-term memory. Psycho-emotionally, there can be a lot of things going on in this age group. We all look forward to not having to work and being retired. However, this sector can experience a lot of changes at this time as they transition to retirement, because sometimes a lot of us identify ourselves by our job. That's where we have a lot of our social involvement and friends, and so when suddenly you're not in that environment anymore, it can create a huge it can kind of lead to depression and cause social isolation in this age group, and so that's why that transition to retirement can be tough. Generally, at this age, they'll start to lose family members, sometimes friends, and even the spouse, and so that can increase issues with the psycho-emotional part of their development. And then they start noticing that they can't do things that they used to. They might need more people to help them do things, go shopping, do yard work. And so they start finding that they're increasingly dependent on things. And so that can also contribute to some of the psycho-emotional issues at this age group. Socially, all of this can tie in with their social issues as well. And so it's really important that they maintain social interaction, whether that is just with friends of their, family and friends, but looking at getting involved in the church, volunteering in the community. There's tons of things to do in the community, at libraries, all sorts of different organizations that will take adult, or elderly volunteers, keeping them feeling like they're important and doing something for the community is huge. Okay. It's nice if they're still capable to actually remain in their home. A lot of times that can create a lot of stress. Some people don't mind losing the home and moving into some sort of gated or geriatric community. Other people don't want to do that. Other people want to stay in their house until they absolutely can't. And so you have to kind of deal with the individual. If they have a home and they want to stay there, you always want to try to provide the services that will allow them to stay there. Obviously, having family and friends visit and help. And then, there's other services that can come in. If you can sometimes get daycare nursing or Meals on Wheels. Those are all little community-based things that can actually help out an individual that maybe needs some assistance but is still capable of staying in their own home. So things to look at in this age group that will need to be discussed with them, dealt with them not only by the clinician but also by the medical assistant, is to really make sure that they can somehow maintain some form of exercise. Once again, we talked about the osteoporosis and osteoarthritis, and there can be a number of things that can limit certain kinds of exercise, but trying to look at their body structure, their strength, and what their physical ailments are, and just still trying to encourage that they do what they can, whether it's walking, dancing, even some isometric exercises, just sitting in a chair, squeezing and relaxing muscles, swimming, even upper body. If they have a lot of knee issues, they can do some upper body things. So just trying to make sure that they stay active, really focusing in on nutrition. This age group tends to skip meals, not always be hungry, and so making sure that they are getting balanced nutrition. Sleeping patterns, which we haven't dealt with yet, is important too. These people, or this age group, has a tendency, if they don't keep busy and have outside interests, a lot of times they'll sit around the house, they'll get kind of tired, they'll sit and watch TV, they'll nap on the couch, and then when it's time to go to bed, they can't sleep. And so they can get really bad sleeping patterns where they're daytime somnolent, taking naps during the day, and then not being able to sleep at night. And those sleeping patterns can come from other things too. A lot of times they're on multiple medications. And so trying to make sure that they realize that naps, it's better not to take a nap if you can help it. They need to develop good habits as far as going to bed at the same time, waking up at the same time, avoiding naps, and making sure that they're getting enough physical activity throughout the day. We already mentioned social contact. You might have to discuss with the patients, hey, what are your interests? Are you involved with the church? Do you have, any volunteer opportunities? Really trying to encourage them to seek those outside social contacts is important. Make sure that they're coming in at least annually for regular health checkups. If they have diabetes, cholesterol issues, heart issues, they may be seen more frequently. Diabetics are usually followed every 3 months. Blood pressure patients might sometimes be followed every 3 to 6, depending on the levels they've been at, but just making sure they maintain those regular healthcare checkups at least annually is important. And then they want to do things to stimulate their brain activity. I think I mentioned earlier Sudoku, crossword puzzles, word searches, even just some TV video, Jeopardy games, things that will keep them thinking and keep their brain active is important. So the next couple of slides talk about a few of the more common diseases and disorders that we'll see in this age group. I kind of already mentioned Alzheimer's. Alzheimer's is a very, very debilitating brain disorder. Unfortunately, there is no cure. It can take a number of years. This disease is kind of divided into 3 stages. The first stage can be anywhere from 1 year to 3 years, where you start having short-term memory loss, mild symptoms. They forget where their keys are. They get in the car and they forget why they're driving someplace. And then that can progress to the second stage, which is a little bit more difficult, where they start having trouble taking care of themselves. That stage can last anywhere from 8 to 10 years. And then the third stage is when they actually get disoriented. They have bowel and bladder incontinence, and they really can't take care of themselves at that point. So Alzheimer's is very difficult to deal with because there really is no cure. There is a pill or a medicine called Tacrin that can help patients in the mild to moderate stage, but once they've gone beyond moderate to severe, there really isn't anything you can do other than maintain their safety and comfort and make sure that they're either in an environment where somebody is taking care of them, whether it's an inpatient or convalescent situation, or making sure that if you have a spouse taking care of them, that they've got the help that they need, whether that be meals or nursing assistance, to make sure that that person doesn't get drained, because when you're watching somebody of this age group, it's a 24/7 job. And they oftentimes, the people that are doing the caregivers, are the ones that need to be watched out for too, because if they get burned out, then there's nobody taking care of them. Arthritis, we'd mentioned osteoarthritis. That's basically a kind of a chronic inflammatory disease of the joint tissue. The lumbar spine and the knees are more common, but it can affect other parts. The problem with this is that this can hinder, not only can they be in chronic pain, so that will sometimes limit their activity because certain things hurt. And so trying to discuss with them, getting them physical therapy, braces, a walker or a cane if necessary, and just trying to discuss with them that there's things that they can try to modify what they need to do if they've got arthritis, and just try to find something that works for their level and their health concerns. So swimming, dancing, walking, things that, that are going to be doable for them and whatever their healthcare issues are. Cancer, there's certain cancers. I'm not going to go into specific types. We've already kind of talked about some of the cancers in the past. Prostate cancer is something that does tend to be more age-related when you're looking at males. Obviously cancer is abnormal growth tissue, growth of cells. And then when those cells are metastatic, they can invade other tissues, and then that can lead to death. And so the book doesn't really go specifically into too much of these. It just kind of tells what cancer is. And so making sure that they maintain all their preventative health care issues, colonoscopies over age 50, PSAs, and digital rectal exams over 40 for males. Women still need to continue pap smears until age 65. If you've had all normal paps and you hit the age of 65, you can stop doing pap smears. Mammograms, there is no target date to stop, and so we're still doing annual breast exams as well as mammograms on women even over the age of 65. But just maintaining all of these preventative maintenance tests is important in order to try to prevent or diagnosing these things. Okay. Cardiovascular disease, why there's a lot of stuff that falls into this category. Not only are you looking at heart attack in general, just because of time and wear and tear on the vasculature. If you've had issues with high blood pressure, then things that can come subsequent to that are congestive heart failure, the valvular diseases that can come from there, from the mitral valve, tricuspid valve, and the aorta. So there's a number of abnormalities of the heart valves. You can have coronary artery disease if you've got high cholesterol. It could lead to either isolated or diffuse coronary artery disease. Over time, if you develop something like congestive heart failure, or the heart gets large from prolonged hypertension, you can then start getting arrhythmias like atrial fib. And so that can increase your risk for emboli and what have you. So there's a whole host of cardiovascular issues that can come from age. And so once again, making sure that they're getting annual EKGs, stress testing is necessary, making sure that they stay on their medication if they are diabetic or hypertensive or have high cholesterol is important. Addressing cost issues and availability issues to make sure maybe they can get their medicines delivered, and make sure that they're not taking any medications that they don't need. You don't want to have them on too many things. We'll mention polypharmacy in a little bit. Cataracts is an eye issue. Over time, it does tend to be more age-related. It's more common over 60. However, excessive UV or sunlight, unprotected, not wearing sunglasses, can cause the lens of the eye to become a little bit more cloudy and opaque, which then over time can lead to decreased vision. Luckily, the cataract surgery is pretty easy. They can replace the lens. But this was a long time ago one of the more common reasons for blindness, but luckily it is pretty treatable at this time. I already mentioned the constipation diarrhea cycle that happens due to lack of water intake, due to lack of fiber, since they don't oftentimes eat a lot of fruits and veggies. Then constipation can occur, and then they'll start taking laxatives to go to the bathroom, and so they wind up in this constipation diarrhea cycle with laxatives and antidiarrheal meds. Making sure, once again, water and fiber are discussed are important. If they've got urinary issues, getting them to a urologist so that they can deal with that, so that they don't limit their intake of water is important. Okay. Now, diabetes, we can see diabetes anytime after 40, and we don't really consider patients geriatric until they're 65. So the diabetes issue could be something that starts as early as 30s and 40s. Okay. But obviously, the older we get, if there is a genetic tendency, then that insulin resistance that we talked about can play a part, and sometimes we can develop type 2 diabetes. So once again, making sure that we're eating a good, solid, regular diet, not, keeping protein, sugar, or carbohydrates and fats balanced. Making sure that they get their yearly blood checks for their blood sugar is important, as well as their cholesterol. Okay. Hypertension is something that kind of seems to not only be family pattern, but also age related. And so over time, the blood vessels just aren't as elastic as they used to be. And so it will sometimes cause the blood pressure to start to creep up when you hit the 40s and 50s. Once again, there can be familial tendencies with it. We like to see the blood pressure at 120 over 80 or below. We've discussed that before. But if we start getting blood pressures 140 over 90 or above, and even if it's one number or the other that's elevated, they will usually treat. And so we just have to be careful. We want to keep that blood pressure at as close to normal as possible. But the other thing too is that a lot of the hypertensive meds can cause side effects. So we do have to be careful when we're mixing it with other medications. Hyperlipidemia is something that also that's elevated cholesterol. We're looking at lipid or fat levels that are above normal. That not only includes cholesterol, but also triglycerides. And so when we're mixing that with hypertension and diabetes, we have to be a lot more aggressive with treatment, because people that have hyperlipidemia are going to have an increased risk for coronary artery disease and then a heart attack or stroke. We already talked about osteoporosis. The one thing I guess I didn't mention about osteoporosis is when we're looking at the brittle bone and the porous bone, that does increase the risk for fractures. And so when we look at fractures, the area of fractures that are more common, we're looking at the hip and the vertebra. So those back vertebra that can become compacted upon each other and get little impaction fractures, versus like a femoral head fracture, because of falls. And so we'll talk a little bit about falls in a couple of slides, but making sure that we keep these people on calcium and vitamin D, supplementation, exercise, limiting caffeine, alcohol, and smoking is very important. Okay, so we touched on this already, but when we're assisting with geriatric care, making sure that they get all of the diagnostic procedures that are needed, just like you would in a younger adult, but making sure that things are done on a yearly basis and not letting them skip a year or two. So there's certain exams, pap smears, colonoscopies, rectal exams, PSAs, mammograms. You want to make sure they get all of their preventive healthcare screening done. That includes annual physicals with regular blood testing for cholesterol, diabetes. And if you have those diseases, then you have to do your maintenance for it. But you definitely want to, if they don't have it, you still want to be screening for it. Okay. When you're talking with a geriatric patient, it's very important to be kind and empathetic, but also respectful. You don't want to call them, you don't want to use the sweetie and the hun and the cutie pie and those kinds of things. You want to be very respectful, and make it Mr. So-and-so or Mrs. So-and-so. You don't want to take the familiar with them. You want to make sure that you stay professional. but empathetic, okay, because they came, that age group is the baby boomers. They came from a bit of a different generation, so we have to always try to respect the way they were raised and what they expect, rather than expecting them to conform to what we now do, okay? So appropriate communication, effective communication, a lot of times writing things down for them. We'll go through in a slide or two the importance of different, things to kind of bring light to what, as far as the education goes, but make sure that you're speaking not above them, not below them, but at an appropriate level for them to understand. Not too many medical terminology words, but not like you're talking to a child either. Very respectful. And when we're looking at the patient education, you really want to try to, once again, promote the preventative health care to manage those health problems, try to catch them ahead of time. We want them to try to remain as independent as possible. If they can stay at home and be able to maintain their own household, and then providing help as needed from that point, okay? If you've got someone that has hearing issues, you want to speak in low, clear tones, not high-pitched tones. Speak slowly. And writing things down is important, making sure that you discuss it verbally, highlighting things that are important on a sheet or discharge papers, and so they know, they have something to go back on. If they're like, oh my goodness, I can't remember what they said, you can always go back to what was written down to remember, okay? And then always give them a phone number to call in case they have any questions. There is as patients get a little bit older, they sometimes aren't aware of their own state of the health that they have. And so if they have health issues, and especially if you're dealing with a patient with Alzheimer's or some sort of dementia, they may oftentimes be in denial or have confusion that they don't know how to work through. And so they don't always know their own state of health. So that's why a lot of times if you have a patient who's maybe got some mental issues that are present, always making sure that you have a close family member or friend there that can actually help to contribute, not control the interview, but to contribute in case the person that's there doesn't know how to answer the questions, okay? It's also important to make sure that they have physical contact. And so when you're talking with them, a touch on the arm or a touch on the shoulder, especially when, eye contact is all very important, because it communicates that you actually do care about them, and that you want them to be healthy and you want them to be thriving. And so that importance of touch is important. And so even, once again, just a little touch on the hand or the forearm, or touching their shoulder can kind of give them that sense of caring. And that's an important thing to convey to them. Incontinence is an issue as well, and I mentioned this before. If you're getting, a lot of times you have to get urinalysis, some form of urine testing on them. So knowing whether or not they have incontinence issues, whether it's nighttime, during the day, if they have stress or urge incontinence, or if you've got a male that's got a prostate issue, a lot of times they'll hide this because they're embarrassed. But you'd want to at least notify the physician if there is a big issue with that, okay? Because once again, they tend to drink less fluids, and then they can get constipated, and so it can become kind of a vicious cycle. The other thing too is to make sure that these patients are compliant with their medications. This is probably one of the biggest issues with this age group, is making sure that they remember their medications and to take them on a daily basis. A lot of times they might have to take medicines 3 or 4 times a day, multiple different medications. And so a lot of times they'll forget. And so really stressing to them the importance of taking all of their medications on a daily basis, knowing whether or not there are swallowing issues. They might have to have their pills cut in half. They might have to have liquid to substitute. And so depending on the scenario, that's an important aspect to know what they're dealing with as far as the patient goes. It's important to try to make sure the patients know what their medication is for, so they know what the name of it is and eventually know their dosage. They don't have to memorize all that, but they should carry a sheet that has their updated medication list with them all the time, in their purse, in their wallet, so that if they get, if something happens and they have to be taken to the hospital, whoever sees them will know what they're taking. Okay. And we'll get to the medication, other precautions in just a little bit. Okay. Blood drawing too, once again, they're very, they can look like the best stick or the easiest stick because their vessels stick out, but since they have less subcutaneous tissue, and oftentimes they tend to be, the skin is much more wrinkled and thinner, it can be very difficult sometimes to actually get sticks on people that are in the geriatric sector. And so, you know, the other issue too is adequate pressure after you draw it. We'll talk about that in phlebotomy, but they're very prone to bruising. And so to make sure you use butterflies or very small needles, thin needles, are important because you don't want to bruise them. And sometimes you barely touch them and they bruise. And so samples can be difficult, or it'll roll. That's another thing that these tend to do. They look like they're right there, and then they roll to the side. So proper technique is good. Using butterflies is oftentimes necessary in this age group because of the fact that the vessels do roll quite a bit. Hot and cold therapy has to be careful as well if you have a patient that's got some sort of muscle pull or arthritic issue. Because the skin is thinner and there's less subcutaneous tissue, the skin doesn't respond or doesn't tolerate heat, excessive heat or excessive cold as well. And so you have to be very careful if you're instructed to use hot or cold therapy, because they can really, their skin can blister if it's too hot, and it can blister if it's too cold. And so you can actually get skin damage. And so making sure that you monitor patients, they might normally, instead of putting it on for 10 to 15 minutes, you'd want to make sure that they put it on for a shorter period of time and check their skin frequently. Okay. A lot of patients with back pain will sit and have hours on end on a heating pad, and that dry heat can irritate the skin. And so it's important to find out, to kind of keep in good communication with your patient and know what their health issues are. Okay, so there's also some nutritional guidelines that we have to look at. Prototypically, what they'll recommend is about 10%, a little bit of a 10% decrease if you're over 50 in the caloric intake, because the metabolism does slow down, and then another 10 to 15% when they hit 75 or older. And so the metabolism slows down, so we don't have quite the same caloric intake need, but that's why the exercise is important too, okay? You don't really want to change your protein consumption. You do lose a little bit of protein over time in the muscles, but you pretty much want to maintain your normal protein amount that you would intake as you would an adult. Fat, you want to keep it about 20%. Sometimes you'll see up to 30. In adults, 25 to 30 max, but you want to make sure that this age level, because of the atherosclerosis and cardiac issues, you want to still keep their total calories, the fat calories, to 20%. Fiber and water are listed there. Really important to make sure they've got enough to decrease constipation, stay hydrated. Supplements might be necessary too. Vitamin supplement. Calcium is usually a good supplement, and a lot of times if they're having appetite issues or getting enough protein in them, sometimes using liquid supplements like Ensure in between meals as a snack can sometimes help if they're struggling to eat enough protein consumption. You don't want to just live off of that, but you could use it as a nutritional supplement if necessary. So things that can impair the nutrition, we can look at physical things, dentures, loss of teeth. If you've had if they haven't had proper dental care, they can start to have a breakdown in the dentition, and so plus the gum issue can also be a problem, and so that can sometimes cause problems with getting the proper nutrition. Once again, we can have that sensory loss or that loss of appetite, which can lead to that. Medications are a big thing too. Sometimes they're on multiple medications, 4, 5, 6, 7, 8 different medications, and if you take that stuff on an empty stomach, it can make you feel sick to your stomach. And so it's important to make sure that they know what medications they need to eat with and which ones they don't. And we want to try to minimize and only give medications that are absolutely necessary. If they start loading up on tons of vitamins, it might be better to pick through and just sift one or two that are important, because we want to make sure that their liver's not working too much either. Okay. Socially, that can affect too. If somebody is depressed because they feel lonely, because they don't have self-worth, they're retired, they don't have the same income, a lot of their friends have passed away or their spouse, all of those things can affect them socially. And so that if they have social depression, and that's those social factors that aren't being met, that can affect their appetite as well. And then the other thing to look at too is whether or not we have someone that's homeless or not homeless. Money can be an issue for this age group. A lot of times if they're only living off of Social Security, they don't have enough to pay rent and meals and all of their bills as well. And shopping is an issue as well. A lot of them maybe don't have a car or don't have the energy or the musculature to go out and go shopping. And so this is where a company like Meals on Wheels or just some sort of nursing assistance can sometimes help these people with meal prep. Preventive immunizations. Obviously, influenza every year is important. This sector over 65, they're one of the higher risk age populations that can die from influenza. They can get influenza, secondary pneumonia, and pass away. So annual flu shots in this age group is recommended, as is a pneumovax or pneumonia shot. That used to be one lifetime, but I think we're giving them every year. I think every year to every 5 years, depending on the shot. The other one that should be here is shingles, and it's not. The shingles shot, the Verivax, or the shingles vaccination is important to get, because a reactivation of shingles is extremely painful and can be an issue in this age group as well. Okay. And so obviously most of the time Medicare will cover these things if that's what they're on. So most of the time things are covered. It's important for them to realize that they're not going to get the disease from these immunizations. It's going to protect them from getting disease and not vice versa. Okay, so when we actually look at special concerns, preventing falls is big. Now, obviously, when they have osteoporosis, a fall could lead to a fracture, whether it's a vertebral fracture or a femoral fracture or femoral head fracture. So we want to make sure that we're looking at the house. We want to make sure that we're making the house safe. You have to look at visual problems, making sure that they have glasses that are appropriate, whether they just need visual glasses or if they actually need straight glasses to see and not just for reading. Making sure that if they have dizziness issues, minimizing the medication. A lot of those meds can lead to dizziness, slowed reflexes, and so we want to make sure we minimize meds, make sure that they know what they're taking, and then look at the household things as far as good lighting, making sure their shoes fit correctly so that if they're diabetic, they're not rubbing and causing some sort of ulcer. If they need a cane or a walker, to make sure they have accessibility to that. Most of the time, these things are fairly inexpensive now, and I believe, Medicare usually covers a cane or a walker. If they're in the house, securing rugs down, using non-slip mats. Handrails in the bathroom are big, because a lot of people will fall trying to get up and down from the toilet or getting in and out of the bathtub. And so that's a really big, huge safety feature, is making sure that that there are handrails in the bathroom, and so keeping everything that they use on a regular basis close by. And so there are actually check sheets and checklists that can be given out to the elderly or family members, and finding out whether or not this is actually what's going on in their household. And they'll ask questions: is there a lot of clutter? Do you have this? Do you have that? And there are ways of getting some of this stuff, the cane and the walker, and the handrails inserted in a house of a geriatric patient that needs it. Now, depression is another thing to look at, and obviously with the change of life that's going through, hormones changing, bodies changing, we're not working as much, we don't have as much money. All of these things can lead to depression. And so then we're looking at the death of family members, friends, and or spouse. And so the key is to try to pick up on depression. And the problem is it can mask as other things, thyroid issues. A lot of things can mask as depression or look like it's depression. There are depression scales that can be given out, but a lot of times they won't always admit it. And so if there seems like there's issues with this, trying to get a family member in there into a clinical visit to discuss it is a really important thing, because you're going to get a different perspective from a family member than you will from that patient if they actually truly have depression. Talking to them about it if they start showing signs of it, realizing that the things that are listed there, sleep problems, not wanting to socialize, not enjoying their life, having difficulty concentrating and focusing, not eating, all of these things could indicate that the person's depressed. And there are medications that can be given. It can be a little trickier treating this age group because of polypharmacy, multiple other medications, and the side effects, but there are meds that can help. And so it's important to identify it so that if depressive, medication or antidepressant medication is indicated, that it can be started and monitored closely. Elder abuse is also something that we have to look at. And so when elders, when a geriatric patient comes in, we always want to look at how they're kept, looking for signs of, either physical or bruises or what have you, looking for physical, sexual, or psychological components. But neglect, abandonment, exploitation can also be there too. A lot of times family members or friends, if that patient has some money, they'll take advantage of them. So you want to always be aware and in tune of this, just like you'd be looking at it in a pediatric patient, looking for how well they're kept. I think this one come over here talks about signs of neglect, if they're not being bathed, if their clothing isn't well kept, if their hair's not looking good, those are things that are going on within themselves, getting them help. If they're living with a family member, is this family member or friend not taking care of them. And so it's important to be able to identify this. And once again, just like in a pediatric patient, if you are suspicious, then you need to report, even if you don't have full proof. Okay. So taking an accurate history, and realizing that this is something that occurs across the board in all racial, socioeconomic, and religious groups and cultural groups. It's not isolated to just one area. And so we just want to make sure that if we see it and identify it, that we report and get help. Okay. Things to look at is this could be a domestic, we're looking at abuse. It can be domestic, meaning within the house. So there could be a family or friend, abusing someone that's elderly. It can be institutional too. So that's why looking at nursing care facilities is important. If you're going to put a family member or a parent in one of those, making sure that you check, you're looking not just at what they tell you, but what you actually see in the facility. Are all of the people being fed? Are they well kept? Are they socializing them, or are they just kind of sitting around doing nothing? So you want to look at all of those aspects, because that's institutional abuse is also a situation that happens. These places get overcrowded. They don't have people in there that care. And so all they're doing is collecting money from Medicare for them to stay there. Okay. And then if there are self-abuse situations, sometimes when people get severely depressed, they might even subject themselves to self-abuse. And so you want to look, that's probably the least likely on this list, but that is something to look at as well. Okay, now the word polypharmacy is really important because it's kind of a multifaceted word. Something that can happen, as we've talked about all these different changes, there can be age-related changes to our digestive system. We've already talked about that. And so medications aren't absorbed, metabolized, or distributed the same way that they used to be. This can not only does this come from the digestive system, but we're also looking at the liver and the kidneys. Okay, those two organs also function as far as metabolizing and excreting things. And so if things aren't excreted as quickly, then they build up in the system, and then they can become toxic to that patient. And so when we're looking at risks, we're looking at drug toxicity from decreased excretion in the body, from decreased liver function, decreased kidney function. A lot of times they're taking multiple medications. Sometimes they're taking, 5, 6, 7, 8, and you can get a crossover reactivity, or they can, once again, if your kidneys and your liver aren't working, they can build up, and that can cause a number of adverse effects from the medication. And so the other issue that comes from that too is that they can run the risk of, if they have multiple doctors, using different pharmacies and having multiple medications that are not always aware. If one doctor is not aware that another doctor is prescribing things, I've actually seen patients on the same medication, but they'll be taking Motrin from one doctor and ibuprofen from another, and those are the same medication, and so they're taking more than what they need, and that can be toxic. So that polypharmacy issue of making sure that they're keeping track of their medications, and they keep their own list, plus using one pharmacy and not multiple pharmacies. That way that pharmacy can track what the patient's on. They can go, oh, this doctor prescribed this, but you're already taking it. And so keeping the same pharmacy, one pharmacy only, minimizing the amount of medications they take, only things that they have to take, keeping an accurate list and making sure that the patient and the family knows, and always giving written instructions on the medications so they know that anything that's new, they know what it's being used for. All right, so we covered a lot of topics here. And remember, geriatrics subspecialty of both family practice and internal medicine. This is basically the care of patients over 65. Just like our pediatric patients have a lot of special needs, the geriatric population has the same thing. And once again, if you're in family practice, you could be seeing anywhere from 30 to 50% of geriatric patients. So just developing that empathy, that care, and just that extra knowledge on how to deal with this patient population is important. Remember, we want to adjust to them and what they're used to. We don't want to expect them to adjust to us. So we always want to make sure that we're treating them with the utmost respect and care and empathy, and always making sure that we maintain a proper professional outlook with them is important. Okay? All right, so just make sure you kind of review all of these things, and I'm signing off for geriatrics.